These type of MCQ discussion that you had done, I feel for a student who is having paucity of time like with MD, so it is a very useful video to watch, and it is very high yield, sir. Like if you watch those videos, you can solve 5 to 7 of MCQs that can come in your exams. Prepared the candidate for the worst. Like I knew that this the main exam may not be that tough, but it really helped to prepare the candidate for the real exam. Like if you face the difficult questions and difficult uh, things in your prelims only, then your mains becomes easy. So that was the plan I thought the grand test had, and it was a really extensive MCQs, and all the candidates. I think it is a good platform for all the neurology aspirants preparing to see how they perform, and what is their status and how to improve. If he wants to just gain all the neurology, he can watch all your videos and make notes, and just be thorough with the notes and give the exam. One concept, sir, I studied from De Jong, like regarding the supranuclear gaze and gaze
Yeah.
palsies and all the that I studied from De Jong, but like I felt that the concept is not strong enough. Then I watched your videos, and then I made the notes. Then it got clear, like the pathway is this, and the lesion. If the lesion is there, you get this disease or something. Then it got clear.
Yeah, good evening, friends. And so I am very happy and proud to welcome Dr. Siddharth, and who has secured AIIMS rank 3 as well as a common merit list rank 6 in the last INA SS exam. And congratulations, Siddharth.
Thank you,
And
sir.
he did his MBBS from Maulana Azad Medical College, prestigious Maulana Azad Medical College, and MD Medicine from Lady Harding. And he is actually a fresher, and this was his first attempt, and it is fantastic to get such a great rank in the first attempt. And he is awaiting his results also soon. Like MD Medicine results is soon awaited. So congrats again. How you feel now?
Thank you, sir. Feeling relieved and satisfied that everything has come in the way.
Yeah, it is actually really, really, really wonderful job to get an AIMS rank 3, that too in the first attempt, the fresh attempt. Really great. And that you comes from the prestigious colleges. You did it for your MBBS, MD, everything from the best, one of the best colleges in the country. So you're going to pursue your DM Neurology in the AIMS only. That is again the best one in India. So, how was your preparation? Like you were preparing along with your MD exam, right? Because you were writing the MD exam this time. So many think that to crack a AIMS exam, it may be difficult when you're writing along with the MD exam. So how
Yes.
you feel? What did you? How did you prepare during that MBA, during the 3-year course, as well as during the last time? How you manage your MD exam along with preparation for INASS or other SS exams?
Sir, basically in the first year of MD, I was more focused in the ward-related works. I learned all the procedures and how to manage the emergencies of the patient. And I used to study only those emergencies and only that management part in first year due to paucity of the time. And sir, in the second year, I had planned that I will do focused approach of individual system, but due to COVID, 4 to 6 months were wasted in that time. So, sir, I decided that I will study the Harrison initial completely thoroughly. Sir, I had actually covered the Harrison part in my undergraduate also. So, in the postgraduate, I tried to study it very with a sharp line, so that nothing is missed, and with a more practical based approach. And I started from the neurology in my second year, and I it was a scattered approach. It was not like I will complete all the neurology in 2 months or something. I started with topics, and I used to see the cases in the ward, and retrospectively I used to study that from the Harrison, and I used to make the notes. And then, sir, in the Harrison also, like it was told that every line is important, word is important for entrance exam. And I also felt the same in this INISS. Like it was completely if you are thorough with your Harrison, then I don't think you would be behind in this exam. So I had studied Harrison multiple times, and also word by word, like in between the tables, below the tables, and all, and incorporated it into my notes. And sir, also I had studied De Jong's neurology in my MD year, because of practical approach to clinical examination for my MD exam, and it also really helped for my neurology preparation.
Yeah.
And seeing the cases, then retrospectively studying about that cases, and integrating it in a multi-system approach really helped to crack this exam. And I felt that this exam was more of a doable exam, slightly on a easier side,
Yeah.
with 50 to 55 questions in neurology, and rest of them approximately 25 to 30 in medicine part. And sir, if you had your studied your Harrison well, and all the MD exams also really helped me to clear this exam also. And I feel like basics is the most important thing. Like, people used to go behind fancy things like Bradley and all, skipping the Harrison. So I think first Harrison should be your base, then you can go for Bradley. Important tables you can see.
Exactly.
So I feel that medicine is the most important crux of any entrance exam, where whichever specialty you're giving, does not matter whether it is neuro or cardio or anything. Medicine is the crux, and if you are thorough with your medicine, you can easily cover up your subspecialty and crack any exam.
Harrison is actually like when you take the neurology part, it has given the entire notes, like it is more like a notes, and
Yes.
it has everything whatever it has been discussed. Most of the things are there in Harrison, and suppose which I actually wondered in the new edition Harrison when I was studying for my DM exam. Like at that time, the new Bradley is not released. The Bradley doesn't
Excuse me,
have
doctor.
the
Excuse me, doctor.
muscle disease classifications, and all those things are not there in the new Bradley also. The new classification, all those things are there in the Harrison. It is given very nicely in the Harrison, but all those things are the tables. To understand the tables, I feel like you need to like go through it multiple times, and you need to understand things. Either you have to go through the basic subject you should know, or you should see the cases. Otherwise, it will be difficult for those tables to understand. And did you prepare anything specifically for like last few months prior to how much gap you got from your MD exam and the INSS exam?
Sir, actually, my MD exam, in between two papers, I had the theory exam, and like paper 3 and paper 4 of MD exam. In between that exam, I had my AIMS exam. I was
Oh,
fortunate that it did not clash.
yeah,
Otherwise, I would not
it was
have been able.
actually yeah. So I think when you are writing an exam like that, it is difficult to prepare for an SS. You were preparing for MD and you wrote it right.
Yes, sir. Sir,
You cannot.
actually, we had our pre-professional exams in the month of March, and after that, I had studied approximately 10 days completely oriented to neurology, because that date sheet was out, and it was announced the date of AIMS exam. And I thought I will give 10 days completely to neurology, and then in the last 15 to 18 days I will dedicate it to my MD exams. So I had planned my last 20-25 days accordingly. And initially I had completed all the topics of neurology in 10 days. I had studied it from my notes, and which I had made during my MD years. And I also solved my MCQs, gave some grand test. And sir, it was an integrated approach. Then I integrated it with medicine, and somewhere here or there during my MD exams of last 15 days, 15 minutes or half an hour something, I used to see some important topics which I was weak at, or uh, some topics which are easily forgettable, some genes and all, I used to see here and there. And sir, it was a bit switch of mode between writing MD exams and then MCQ exams. But I guess, sir, everything went in a flow, and it got worked. So
And how was I mean, other than Harrison, did you went with any other material? Other your notes were like based on Harrison de Jong. Other than that, how did Marrow help you in any way? Like you were going through Marrow.
sir, I had subscribed to Marrow in the month of February. I got to know a bit late, but I had studied some important videos. I must have watched approximately 10 to 15 videos of yours, and which were very important for the entrance exam, sir. I feel, sir, it is according to the student to use the resources according to
Yeah,
his or her needs. So some topics like, sir, autoimmune encephalitis, neuroinfections, and these you have leukodystrophies. You have covered very well. In your short lecture, you have discussed some MCQs of epilepsies. So, sir, I believe that they are the crux of any entrance exam. Like, if you get some important points, and then you can grab those points and use in your pre-existing knowledge. Like, sir, Eglon 5 was discussed in your autoimmune encephalitis. That came as a MCQ.
yeah,
And neurocysticercosis is frequently asked in names, and it is not well covered in Harrison. So I
Harrison.
had
Yeah,
watched your videos, and you had given all the important points, like the criteria, major, minor, absolute, and that also came as an MCQ. And sir,
yeah,
it really helped to like whatever points I was weak at, or I was lacking that topics, I referred to the videos of yours, and all those videos were so high yield that like leukodystrophies, epilepsies, and management of stroke like endovascular therapy. We had discussed the class 1A, 1B recommendations,
yeah,
and the devices. All those are stroke was a expected topic with 10 to 15 MCQs, but this time the questions on stroke, I felt
yeah.
that it
Actually,
was on a lesser side, but
yeah,
that is a very important topic that you can't miss if you are giving
yeah.
for neuro.
Yeah, any neuro exam actually every time there is a lot of questions keep on coming from the stroke. I was
Yes.
also expecting a lot of questions to come from stroke because last time both INA as well as in NEET SS stroke was the most important area actually in most of the exam. But this time the question paper actually it was very like stroke was less covered.
Yes, sir.
And when you are in the MD also, when I was also in the MD, stroke is one area you will be exposed to more and you will be studying more because there will be a lot of any CMD whether it is medicine there will be one topic will be discussed on management of stroke or endovascular therapy on stroke or most of CMEs it will be there. So I was also expecting many questions to come from that area, but less things came. And about the what all topics you told, actually those which you had mentioned like neurocysticercosis, neuroinfections, leukodystrophy, actually those things I kept as an MCQ because it is difficult to cover as a theory. It is more of a MCQ oriented thing only, and those things actually it's not covered properly in Harrison as well, like what you
Yes.
told, because these areas are very raw areas for a MD medicine person.
Yes,
And
sir. That, sir, these type of MCQ discussion that you had done, I feel for a student who is having paucity of time, like with MD, so it is a very useful video to watch, and it is very high yield, sir. Like if you watch those videos, you can solve 5 to 7 of MCQs that can come in your exams. So if watching those less number of videos will yield you higher number of MCQs. So and those videos are very important, which is done in a MCQ way. So it also the student enjoys watching that video if it is in a MCQ way, and then you rule out options and you say why this is not. And sir, also congenital myasthenia gravis you had covered really very well with one MCQ video. It was a very short video, but it had all the MCQs. And AIMS has this habit of always asking one MCQ
yeah,
from congenital
definitely.
myasthenia gravis, but this time it was not focused. But still, it is a very important topic to prepare for neurology.
Yeah, actually, there are actually I also felt like there are two group of students are there. One group is just like you; they are actually preparing for MD exam. They don't have much time to prepare
Yes.
for SS because there will be more, and especially during the COVID time, like in Delhi was very a lot of cases were there last year also. So you were second year and third year beginning will be completely in COVID only. So it
Yes.
will be tough for you people to take time and prepare. And there is another group of students who will be taking a break for 1 year after finishing the MT and sitting and studying. They can actually go through the entire subject, entire videos. But those who
Definitely.
are preparing for MD, actually, I also suggest them you can select topics which are high yielding, and whether it is not only from the neuro, like when you're preparing for your MD exam, the Marrow actually offers an advantage. When you take the app, you can go to any specialty. Like you can go to cardiology, you can watch videos from nephro, neuro, anything. So you can take a topic which is high yielding in any subject, and you feel Harrison has not covered, you can go through that topic from the Marrow app, whether it is whatever subject it may be. Even when I am practicing right now as a neurologist, I am also using some of the videos of Rakesh sir or Nishant sir. I will just go through that because some cases come. So in practical area also that is helpful, as well as in the exam oriented also. So that is, I think that may be a suggestion for those who are writing MD exam and writing the INSS or NEET SS along with that, who doesn't have much time. You definitely have to go through the MCQ part, because MCQ part covered some of the core areas which is not much discussed in Harrison, as well as those topics you feel it is important. I again recommend everyone to go through stroke, because stroke is one area. Even though this time less questions came, but usually stroke is one area. A lot of questions come and a lot of updates are happening. And how did you like prepare from whatever videos you're writing? I mean, you're watching. You were writing down notes, right?
Yes, sir. Sir, I made some notes of the important points, and like some important points or some important notes, and all the volatile things. I had written it separately of your videos, and in the last minute I revised it in like in between the exams, so that it stays in the memory fresh.
Yeah, and one actually, why did you have chosen neurology above other subject? Because you did from very good college, hospitals and colleges, and so you will be exposed to many specialities. Unlike
Yes.
me, who was done from a normal medical college, I was not exposed to much of super specialty when doing my MD. But you might have been exposed well to super specialties. So why you have chosen neurology rather than other subject?
Sir, actually, I was very focused in medicine, sir. Actually, I thought that I will not do any super specialty because it narrows down. But I was so in love with medicine that I wanted every subject to be part of mine. But unfortunately, sir, over a period of my PG management days and all, in the later half, I realized that the super specialty and role of specialist is important in the like complete management of the patient. So I thought I will do neurology because, sir, it is one branch where you are exposed to clinical examination, and it is one of the few branches which is remaining, which includes clinical diagnosis, rather than focusing on completely imaging or completely radiological or investigational based diagnosis. So it is like a math, sir. Like if you know four or five formulas, then you can apply it to reach a syndromal diagnosis, then you can localize, and then you can say what is the etiology. So it is just like a interconnection of every neurons, and you can just apply all the formulas that you can, and you can reach to a diagnosis. It is like a solving a puzzle. So neurology fascinated me at the end of my first year or something, and I used to see neurology cases with more interest. And in my college, sir, there was also some more discussions about neurology cases, and some of my consultants were more interested in neurology. So that also might have added up, and also my interest in neurology might have uh, helped me to take neurology as a career option.
Yeah, actually, when I was interviewing candidates in last year as well as this year, I had an interview with Swati previous night. They also were telling the same thing. What I understood is I also had the same feeling. Like most of those who were chosen neurology were actually those people who like medicine well. Those people, most of them wanted to continue as a physician, because
Yes.
neuro is one subject which is like a super extension of your medicine. You need a neurologist should be the actually from all super specialists. I think neurology is had to be the best clinician, because your investigation of choice, your diagnosis, everything depends upon your clinical diagnosis.
Yes.
Without history and clinical diagnosis, you cannot proceed in neurology. Unlike in many of the other subjects, I had seen many cardiology, but particularly many people taking cardiology because they have a natural interest towards cardiology. When they're studying, they have so much interest into cardiology. But what I had seen is most of those who have taken neurology, they have a natural interest towards medicine. They want
Yes.
to practice as a good clinician, good physician, then they are turned to a neurologist, because neurology is something which is very much near, which is lying very much like a medicine.
True, sir.
Yeah, and how was this time INISS exam? How was stage one and stage two? And stage one, how was it? How you already told that there's less questions came from stroke, and it was actually a bit simple when compared to last INISS as well as the NEET SS. Last NEET SS actually question was a toughest at like in the last 2 3 years.
Yes, sir.
Yeah,
So,
how you
actually,
feel the exam?
when I started the exam, I actually finished the exam in 25 to 30 minutes, sir. And I was so relieved that I could finish all the 80 questions in one go in 30 minutes, because I feel time is the most important factor in
Wonderful.
determining your rank. And sir, my aim was to finish the paper as early as possible, and whatever questions I had like encountered, and I can just click in a first go, I attempted that questions. So sir, approximately 65 to 68 questions in 65 questions I had attempted in first go in 25 to 30 minutes, and rest 15 questions, sir, I again went through it in the second go, because if you attempt the paper in one go, then some information you can gather, and you
Yeah,
can utilize that information to solve those questions which you are not completely sure, or some you have some doubts. So those 15 questions then I attempted in another 10 or 12 minutes. And sir, then I again went through the paper one time, and I had attempted 78 questions out of 80. And sir, unfortunately there were two questions which I changed, like I had marked correctly then in this revision part I had changed the option to some other option, which and I lost that two question. So sometimes, sir, this revision also can, enhance or can degrade. So fortunately that did not matter much in my rank.
actually, it happens like when you have when you have too much time left, you will go back and review the question, and you will think so much, and then you will change something. It happens always in all exams.
True, sir. True, sir. That is one disadvantage. And sir, actually, it is always told to every candidate, like since NEET UG days and PG days, like you don't change the answer. Whatever you have done, the mark the option that may be the right answer. But sometimes, sir, it happens like two questions I had. I was planning to change the answer, but since I had already changed two, then I did not change those two. So those two got wrong, and this two also, which I changed, got wrong. So sometimes, sir, it really creates a havoc. But sir, it is very advisable to finish your paper as early as possible and give
Yeah,
one look to your paper. And I would, sir, one mistake that I did, that if it's a logical question, then you can change the answer. Like logically, if you're feeling that this is not the answer that you have marked in the first go, then you can definitely go. But it is a if it is a theoretical question, if it is a fact based question, then don't change the first answer that you had marked. So that is one rule of MCQ that is there. So I would like to highlight this so that other aspirants don't do this mistake.
yeah, exactly. Actually, last time I think last INSS before preparation, I was telling them to do in three part. First part you go through the question. Second part you attempt the things you have not attended, and third time you go through once again, because after reading some questions you will get some clues regarding the some questions you were not knowing. And how was the stage two? How many questions were asked to you, and what like it was very random questions every time.
Sir, actually, this time stage two was having a new format. Like they had asked just a one question to each candidate, and my question was it was a CT image with a intracranial bleed. So I had described the lesion first, and then the professor asked me what is the likely diagnosis. Then it went to what is the area involved. Like it was involving the area of globus pallidus and internal capsule. So and also some part of thalamus. So the professor asked me what are the parts of the basal ganglia which is involved in this image, and then what is the clinical deficit you will get corresponding to the lesion, and how will you manage this case. And sir, there was some discussion about chorea and athetosis because it was involving globus pallidus. So he had asked me what is the movement disorder of globus pallidus, and then like treatment option of hypertensive bleed, and what is the target blood pressure. So it lasted around, sir, 8 to 9 minutes or something, and just one question was asked, but there were sub parts to that question, like three or four sub parts. So fortunately, sir, it was good for me in the interview, and I had got 18 out of 20 in the interview.
Good, good.
So I was fortunate that it added to the marks of theory.
Actually, last time onwards, it is online pattern of stage two. Since
Yes, sir.
that has come, they will ask very random questions. I mean, last time some of the candidates even they asked about their thesis in MD days, and they had asked questions from that also. So it was very random question. Like you cannot expect what they will ask. And last time also they asked only one or two questions, and like the same way they just put some image. They just want to know your approach rather than your diagnosis. They just want to know how you are going to manage. And what I think is even in all central institute, they want the candidates to have an aptitude to the course. They want to know that whether these person they know that you are MD, we all are, you all are MD fellows. You may not be as much knowledgeable as a neurologist. They don't want to check your knowledge. What they want to know is they want to know your approach. They want to know whether you will be able to manage such a scenario, and whether you have an idea how to approach to that rather than mugging up things and passing in entrance. That is what they want to know in from the interview. That is what I understood from the last 2 years in exam pattern. And what suggestion you have to give to the candidates who are going to write the NEET SS? You might be having a plan to prepare for NEET SS also, because you will get a better time, like your according to your schedule of your exam pattern, you will get a better time for preparation for NEET SS. So, what was your plan? Suppose you were not getting into the AIIMS, what was your plan in the mind? You might have a backup plan also. So, what was your plan like that?
Sir, actually, my case is a bit of different, sir. Actually, I had given my MRCP part 1 and part 2 in my PG days. And, sir, since I had missed my AIMS Delhi in my MBBS and MD days, so I thought that I will give one attempt for DM Neurology at AIMS Delhi. If it is not, if it does not go well, then I was planning to go to UK to pursue my neurology residency, sir. So that was my my backup plan, sir. So I really thought that I will give just one valid attempt to neurology, and thankfully, sir, it got ended well. But sir, if I would have prepared for NEET SS, which is mostly in the next month or something, then I would go through all the MCQs, sir. Like whatever the question bank is having, then all the MCQ either topic wise or grant test wise. So that you can't, sir, in 1.5 months you can't study complete medicine and then solve the MCQ. Rather, you can do retrospective approach where you can solve all the MCQs that you're having, because you have just finished your MD, or post MD candidates also, they have studied their medicine in their MD days. So it is better in the last few months to revise only those things that the candidate has studied earlier, rather than making some new videos or new notes or something like that, new source. And
Yeah.
better to focus on only the important topics of all the subspecialties. Like NEET SS is having 150 question of all the subspecialties.
Subspecialties, yeah.
So better to focus on only highlight areas, and retrospectively do MCQ. And if you are finding that you are weak in some topics, like if in neurology you're weak in dementia, then you can refer back to only your dementia notes, or whatever you have studied dementia. Then you can just refer and solve that, rather than completely studying the neurology at the last minute. So it is, I think it would have been my approach for the NEET SS if I was giving.
Yeah, that is definitely what you're telling is definitely right. Actually, it was a good plan. What you had in the mind was actually definitely true, because you cannot read the entire neurology, all the subspecialties in 1 or 2 months. You have to go through MCQ. Your weak areas, you have to go back. And how was the Marrow grant test when you attempted it? How was the test going? How did you feel?
Sir, Marrow Grand Test was it was very tough, sir. I must say that all the 80 questions, it was a brainstorming session, and I had just given the test 3 days before my MD exams. I thought I will just give a try. So it was very tough, and it included all the updates, like all the new updates and all the new drugs, genes, and it was a balanced paper where it prepared the candidate for the worst. Like I knew that the main exam may not be that tough, but it really helped to prepare the candidate for the real exam. Like if you face the difficult questions and difficult uh, things in your prelims only, then your mains becomes easy. So that was the plan I thought the grand test had. And it was a really extensive MCQs, and all the candidates, I think it is a good platform for all the neurology aspirants preparing to see how they perform, and what is their status and how to improve.
Actually, when I was putting some few questions, I given some questions for the grand test, and my plan also was to like there was a lot of updates which came in 2022 and 21st last. Some new drugs, new things has come up. So I just want to put all those things at least in some options, because I was
Yes.
expecting some questions to somewhere to come, because the new things. Otherwise, I cannot put all new things in a separate video. So it was easy for me to go through that, put some options here and there, and give that update. Some new updates came up in the 2022 this year beginning as well as last year end. Yeah, so like when you now you have got entry into the prestigious AIIMS. Now, what is your plan after this? Whether you have any plans? Because when I ask this question, when you are joining DM, you will have the same answer like I had when I was joining my DM. I'm just going to pursue neurology. But when you are going to enter into some institute like AIIMS, it is not like other colleges, like all the central institute are same way in that way. Like when you enter into such institute, like you will have to choose something, because what happens is when you join it there, then you will have some thesis. They will give you some thesis. So when you take a thesis, if you may in the future, this is like what I think is in the future, when you finish your DM, you will think like, oh, okay, now I want to do some subspecialty on that. So when you're giving a thesis, you may have to decide a thesis which you want to pursue, if you want to pursue as a subspecialty. Because if you take a thesis, then most likely you will get an entry into that subspecialty. Suppose you're taking a thesis based on movement disorder or epilepsy, you will be trained slowly, will be deviated to that area. So whether you have any interest like that, whether you have thought about that.
Sir, regarding the fellowship, sir, I think as you mentioned, it is too early for me to decide upon the fellowship, because I am yet to explore the complete
Yeah.
subspecialty of neurology as a whole, like the complete exposure and dealing with the patients and the management and the protocol. And that will, I think, by doing the residency, I may develop some interest in some subspecialties of neurology, and that has to be seen later, sir. Not like I have not pre-planned or something like that I will do this or I will do that fellowship. I have not like completely pre-planned, but sir, the idea is to completely enjoy the neurology first and learn the entire neurology as a whole, rather than focusing. But because sir, it has already been focused to neurology from medicine, so then further, if you just focus then on neurology like movement disorder, epilepsy or something, that will really become like too narrow stream for me. So I have not completely decided, but yes sir, as you said, if things like that come up in my residency or some option is there, then it will be, sir, sort out after having exposure, even exposure of all the subspecialties.
You will really get a chance for that, because unlike other institute or other places, when you are doing in AIIMS, you definitely will get exposed to all those things, and you have actually that is the best thing when you are choosing an institute. Especially for neurology. Neurology nowadays actually it has become lot of subspecialties: the stroke, the interventional stroke, medical stroke, the movement disorder. So when you that is a main advantage when you're taking in a institute. First thing, you will be getting orientation towards subspecialty in a better way, and you will get to know that which is suitable for you, and you can pursue that later. That is a main advantage when you're writing INSS. That is why when I was taking the class, orientation session also, I was telling in INSS, if you want to pursue, you if you want to go further into neurology, like you want to go into subspecialization, it's always better to do in an institute, because then only you will be exposed to subspecialty. Otherwise, you will be just like doing general neurology in any other colleges. And actually, we didn't. I have not asked about your like how is your family? Who all are there in your family? Are you married or?
No, no, sir. I'm unmarried, and my family has really supported me in this journey, sir. I have my younger brother. He actually came. He's studying in New York University, and he came last 2 weeks before only. And sir, he has given so many interviews in his career. So he gave me one advice, like in interview. You have to be like looking into the examiners, and you have to be completely confident, and you have to present yourself in such a way that it's not like, examiner ask one question and you just have to vomit out everything that you know about that topic. You have to be focused, and you have to show, and you have to keep your composure to answer that question, even if you know everything about it. You can't just show your excitement that I know this question very well, and just jump out and tell everything. So it was just one thought that if you mentioned about family, and I really had that one thought which I wanted to share to other aspirants. And my family, my friends, and my teachers, they played a very important role in securing this seat. It wouldn't have been possible without them, and I would like to use this platform to thank them. Thank you for bringing that, sir.
Yeah. And actually, what you from the I done some 3 4 interviews of candidates. From this, I feel like this interview actually, unlike many other interviews are also good, but this interview will definitely help those who are pursuing to write the INISS or NEET SS, and they are actually preparing the final year, because you are
Yes.
such a candidate who were actually very well to tell that you are telling that how you have planned for your MD exam, and how you were planning to face an interview. Actually, all these are actually the points the next coming generation who is going to write the exam has to be taken. And this interview was actually, I also enjoyed for what all things you were telling. Like I has actually not prepared for any institute exam when I was doing my DM, like my doing my MD. I just wrote NEET and I got a seat. I want to take initially I took cardio, then I changed to neuro, and I like neuro, but I took cardio, then I changed to neuro. But you were like, now actually the present generation, like we don't have much generation gap actually. We 3 4 years difference only, but the aptitude of students has changed a lot. Previously in our time, where I was writing the first NEET exam, the first NEET SS exam. So from our time, it was like more of like state exams, so their seats were very less in the state exam. So we were more oriented towards medicine, and we were thinking, okay, if you going to write an exam, you will plan after finishing MD, we will decide which subject you like, then you will go into that. And now the students has already having an opportunity to write a NEET exam. So they will be actually by second year, third year, they will be oriented towards one subject, and they will be preparing towards that. Majority of the students. Previously, only few students will prepare for a specialty. Majority will be choosing like medicine. Now the scenario has changed, and there is a lot of platforms like Marrow is there, where they can get many informations available in the net. They can use it. They can write exams. So it is actually wonderful for the students' perspective. At the same time, it is tougher because the competition is very tough now.
Yes, sir. Yes, sir. In neurology, I did not expect, sir, like over 150 students were qualified for this INISS, and other specialty. If you look, sir, 40 50 candidates were qualified, but I think neuro and endocrine were 150 plus candidates qualified, who got more than 50% in stage one. And sir, as you mentioned that there are multiple resources available for preparation, due to which the competition has grown, like it has multiplied so much. Like if 3 4 years back, it may not be that much, but this time, you are having so many resources, and like you have taught all the neurology, 100 plus videos where are there. So someone who is not like, if he wants to just gain all the neurology, he can watch all your videos and make notes, and just be thorough with the notes and give the exam. So the approach of the students have really changed, and thankful to all your videos and Marrow for that. And sir, one advice that my close friend has given during the preparation, like initially in my UG days, I was very extensive in my preparation and my knowledge. Like I used to study Harrison page by page for all the systems like cardio, neuro in my undergraduate days. But sir, like if any competitive exam is there, you have to be oriented and focused to clear that exam. It is not about having the knowledge to clear that exam. It is about just the pattern that you have to study, and orient yourself to what they are asking, and what they are expecting from you, and what are the topics that they are focusing every year, like stroke, dementia, epilepsies. These are all important topics, so you have to just be thorough with only those topics, and you have to narrow it down to one copy of yours, like you can make your notes, you can watch videos and make notes. And if some extra information, extra points you have taken from grand test or some test that you are giving, you can add that in your notes. So I think one such strategy, it I got from my close friend, that you have to be focused only on those topics that your competitive exam pattern is there. So rather than an extensive approach, like
Yeah,
completely studying Bradley is not possible,
possible.
either a MD or in post MD. If you're pursuing MD, then it is highly impossible. And even if you complete your Bradley completely, so then, sir, the yield of that knowledge that you can use from that study to your solving MCQ, I think, sir, that may not be appropriate. So it is wise to focus only on those areas which is important, and retrospectively solve your MCQs and be thorough with your concept. Because, sir, concept will only help you to solve MCQs, because you can't predict the MCQs like what they are going to ask. But if your concept is strong, you can derive anything, you can
Yeah.
rule out the options, and you can like go get to the correct answer. So I think conceptual knowledge is very important. And then adding to that, you can have some no, theoretical knowledge of genes or chromosomes or all these volatile like trials. Then you can add it on your concepts. So I think it will be a good mixture, rather than completely going through Bradley. And focusing on Harrison is the utmost important step in clearing any entrance exam, be it NEET SS or INISS. Because, sir, considering this INISS pattern, I don't think like if you study whole Bradley page in, you would be able to like clear it. I am not sure about that, but it is very wise to focus on Harrison, because 35 questions are from medicine only. So it is also important to focus on those 30 questions.
Yeah, actually, I have finished my DM. Even now, I can tell that it's almost impossible to go through entire Bradley. I have not read entire Bradley. You cannot do that, because Bradley is something which is so extensive, so vast. If you read it, the moment you finish reading at least part one, you will forget the first part what you read. It's always like that. It is so excessive, and even in DM, you have to go through concept base. You, if you know the concept, then you go through some articles, you read Bradley, and you saw the case, then you will realize. Otherwise, you will forget. Even like even during the before the exam, some of the students were asking me like, "Sir, how much times you should read through Bradley?" I told them that you cannot read Bradley 2 3 times. I have not read entire Bradley even one time. Like, you cannot read it. It is impossible. You can, like, I may have read it when I have seen some cases. I may have gone through some areas, and I have read the Bradley important topics. May have gone through some areas, but I will not able to remember. Nobody can remember the entire Bradley. Even Harrison is much simpler when compared to Bradley, because it has a notes of Bradley. And only thing is the Harrison. The problem I felt is many things are given very concise in the tables. Without concept, you cannot able to understand it. You cannot by heart things like that.
So
Same thing what
then
you
you
told.
can, then you have the option of watching the videos, sir. That is when the videos come into play. Like if
Yeah,
some concepts you're lacking, sir, then you can just retrospectively go and watch the videos to clear your concept. Like one concept, sir, I studied from De Jong, like regarding the supranuclear gaze and gaze
yeah.
palsies and all the that I studied from De Jong, but like I felt that the concept is not strong enough. Then I watched your videos, and then I made the notes. Then it got clear, like the pathway is this, and the lesion, if the lesion is there, you get this disease or something. Then it got clear. So you can use your resources very wisely
Yeah.
at that time, when as you said, sir, when the concept you have to make, then you can like if it is not clear, you can watch the videos to clear the concept.
And thank you, Siddharth, for coming live. And it was really, I actually enjoyed the interview. And I was actually, I mean, I wish I could be like you when I was doing my MD. Like, because my time actually at that time when I was writing the first entrance exam, there was no other platforms, nothing was there to use. There are some few question banks were available from where we can get some questions, and some like online group are there which they put some Kerala questions, and all we used to go through that. That is only options we were having the advantage of the video is like you can watch it again. You can have the visual audio as well as you can adjust the speed. So that is a lot of advantage of having the
Yes.
new parts of education. Has lot of changes come up. Not only Marrow, any platform which has been come up, actually has helped students a lot, the new platforms. And thank you so much to coming, and I really enjoyed it. And all the best for your future. And I also tell all the students that at least go through this interview. It will help you, all those who are actually pursuing MD and planning to write the first exam. This is the exact way you should follow. Thank you so much, Siddharth.
Thank you, sir. Thank you so much for calling. Thank you, sir.